Assalamualaikum and good day everyone. I'm Nurul Aisyah binti Muhammad Nasir and this is my partner Fifi Farah Nur Hazira. Today we will presenting a topic that is often overlooked but deeply important, which is maternal mortality. Malaysia maternal mortality ratio back to pre-pandemic level. Imagine a woman who excited to become a mother, but because of lack of care or information, she never survived childbirth. Sadly, this still happen even here in Malaysia. In this presentation, we will explain what maternal mortality is, what caused the increase during COVID-19, and how Malaysia recovered after the pandemics. Next, I will pass to the Fifi for the continue the next slide.
Assalamualaikum, my name is Fifi Farano Hazira binti Habibun. Thank you Aisha for the introduction. In this presentation, I will cover three main points. First, I will explain understanding maternal mortality. Second, I go through under 5 mortality rates by sex in Malaysia 2023. Lastly, I will present the key takeaway for ensuring safe motherhood. Understanding maternal mortality. Maternal mortality is defined as a death of a woman while pregnant or within 42 days of the end of pregnancy due to causes related to or aggravated by the pregnancy is management. The impact of the death of mother is more than just a personal tragedy. It has wide-reaching effect on the family, community, highlightly healthcare system quality. Preventable. Usually, mortality deaths caused by health problem that can be or proper prevent with proper care, such as excessive bleeding, infections, high blood pressure, and unsafe abortion are all conditions that can be treated or managed with proper medical care. SDG 3 indicator. SDG 3 stands for Sustainable Development Goal 3. It's an indicator of a country health system quality aligned with Sustainable Development Goal 3. To meet SDG 3, nation must invest in maternal health care, improve infrastructure, train more skilled birth attendants, and expand access to service for all women, especially in rural and in underserved area.
Okay, let's look for the credibility and research focus. Why we choose this topic? Because maternal health was seriously affected during the pandemics. Many pregnant women missed a checkup and hospitals were overloaded. This make we ask, was Malaysia healthcare system ready to protect pregnant women? Has it improved now? To answer that, we use information from two reliable sources, which is the Department of Statistics Malaysia (DOSM) and also the Gallen Center, a respected Malaysia health research organization. These sources give clear and trustworthy insight on the situation.
This is the pie chart of under 5 mortality rates by sex in Malaysia 2023, taken from annual maternal death statistic 2023 from Department of Statistics Malaysia. Under 5 mortality refer to the deaths of children under 5 years of age. It is an important indicator of child health and survival. Based on the data, male children have a higher under 5 mortality rate, account for 55.5%, which is 9.1 deaths per 1,000 life birth. In comparison, female children account for 45.5% or 7.3 deaths per 1,000 life birth. The difference can be explained by biological vulnerability in male infant as well as environmental and social factors. However, in some regions, girls may face a higher risk due to base gender discrimination. Why can maternal mortality sex occur is caused by biological factor, global trend, and improved later childhood. Biological factor may explain the difference. Male infants are more Infants are more biological vulnerable because they tend to have a weaker immune system, are more prone to birth complication and infection, and generally experience slower lungs and brain development during early life. Globally, boys are slightly higher under 5 mortality rate than girls.
Okay, I continue for the causes of maternal mortality. This bar chart show the main causes of maternal deaths in Malaysia in 2021, when the pandemic was at its peak. For the first causes is COVID-19, 57.3% for total case. Most deaths were caused by the virus itself. Many pregnant women had breathing problems and could not get help in time. Hospitals were full and some were too afraid to go for the checkup. For the second causes is postpartum hemorrhage, 6.7%. This means having bleeding afterwards. Some women could not get emergency care, especially during a lockdown. The third one is high blood pressure in pregnancy. 5.7% total case. It condition like preeclampsia can become serious without regular checkup. Fourth cause is obstetric embolism, 3.3%. It's rare but dangerous condition where a blood clot blocks blood flowing during delivery. And the last cause is ectopic pregnancy. The percent is 2.3% for the total cause. This is when a pregnancy grows outside the womb, especially in the fallopian tubes. It causes internal bleeding and needs emergency surgery, but not all women could reach help in time. These causes show that most maternal deaths were preventable, but the pandemic made access to care much harder. Thankfully, by 2023, Malaysia's maternal mortality rate returned to the normal. This shows that the healthcare system become stronger. The improvement include vaccine program, better hospital services, and also more awareness about pregnancy risk. This effort help protect more mothers and save lives.
My last point is the key takeaway for ensuring safe motherhood. Firstly, early checkup. The importance of early checkup is to detect and manage potential complications. Early checkup helps ensure that both the mother and baby are monitored closely and any risks can be managed before they become life-threatening. Second, skill care. It was access to trained professionals throughout pregnancy and childbirth. After that, education. Education is the most important thing for empowering women with knowledge about maternal health. When women are educated, they are more likely to understand the importance of prenatal care, practice healthy behavior, and recognize early signs of danger during pregnancy and childbirth. Lastly, strong healthcare system. Robust infrastructure and resources to support maternal health. A strong health a strong healthcare system is the backbone of effort to reduce maternal mortality. It ensure that women have a continuous access quality. It ensure that women have a continuous access to quality care before, during, and after childbirth. That's all from me. The conclusion will be made by Aisha.
Thank you, Fifi, for the explanation. In conclusion, we learned that maternal mortality is still a serious issue, especially during difficult times like the COVID-19 pandemics. But with proper care, education, and support, many of these deaths can be prevented. Every woman deserves to feel safe when giving birth. Every mother should have a care and information she needs to survive. Together, we can make sure that no woman die while giving life. That's the end of our presentation. I hope you now have a better understand of this issue and why it's matter. Thank you for listening.
Thank you.